And let's do a cahoots. Now, this week is all about cardiovascular. It's all about respiratory. I put in the cahoots, all the concepts. I couldn't load your PowerPoint, so when I get your recording this evening, I will be putting it in there for you. I knew you weren't going to be looking at it anyway because you're going to come and do an exam. And remember, this week we do have a CJ Sims due. I will tell you, CJ Sims are really high in the amount of percentage of your grade. Make sure they're in on time. Each one is 5%. That's how much they're worth. So make sure they get in. Now, anybody who wants to come meet me with respiratory cardiac, you want to know more than what the Kahoot is, just let me know and I'll make that appointment for you and I'll see you. And Christian, you only had one math question wrong, and it was the microgram milligram one. The other one was correct. Just so that you
Woohoo!
know. Yeah.
Okay.
No, not bad at all. No, you did good. Don't worry.
Thank
You're
you.
you're cruising. You're cruising. So respiratory and cardiac. Excuse me.
What was the panic?
Acute coryza is another name for what? Let me get your pin again for you. 601-4530.
4.
601-4530. This is just it is a common cold. You're going to see it again. That's one of the terms that you need to know. Acute croup is also called. This is that barking, inspiratory, stridor, upper respiratory. It's the swelling of the oropharynx. But where in there is it called? Now, croup is the larynx, the trachea, and the bronchus, and it gets really swollen. And this is your child when they bark like a seal, a really loud, forceful cough. Laryngeal tracheal bronchitis or croup is the same. Now, epiglottitis will occur, which is when the complete closure of the epiglottis over the larynx when you don't treat the croup. Croup is just steroids. It's a virus and it's something that we will just symptomatically treat, but they do need that steroid or it could come into epiglottitis, which is a true and real emergency. There's no airway. What term is used when describing the collapse of an alveoli? What is an alveoli? Where is it? What does it do?
In the lung.
Yes, it is. It's the base of the lungs. That's what's held open, and that's where exchange of oxygen and carbon dioxide is. And we're always concerned after surgery for that atelectasis or those collapsing. So that's why we deep breathe and we cough, right? And we teach our patients that. What is tachypnea? Well, what's tachy and what's the apnea? You have apnea, you have tachypnea, right? Again, a lot of your exams are a lot of these definitions and these words. And once you remember those words, you can put the pieces together. Tachy means fast. Pnea is respiration, so it is increased respirations. Cystic fibrosis is mucus in the lungs and in the small intestines, and you don't digest fat. So you're going to have problems breathing, so you need respiratory care. And then you're not digesting foods. So you need to take a pancreatic enzyme. One of the names is pancreatase. It's trying to help the pancreas and trying to help digestion of fat. These children, it's all about nutrition and about pulmonary care. When a child has a fever and upper respiratory infection, what should be included in the nursing care plan? When you have a fever, what happens? Upper respiratory, you're breathing hard, you're coughing, you're losing more weight. So with this, we have a fever, you don't feel well. And children, when they don't feel well, the fever, they don't eat, they don't run around, they don't drink fluids, which is what we want. Get the fever down and give them their favorite sort of drinks. They like apple juice. This is the time to give it to them. They want a popsicle or whatever liquids get in them because it keeps it loose, keeps the fever down. Asthma causes what? Asthma is one of the common childhood conditions that happens, right? Some of we have it, and some of you grow out of it. But it is that diagnosis where you have the increased school absences, you have increased doctor visits because you can't breathe, and of course, then increased hospitalization. So, asthma is a big thing, and the teaching of that prevention of asthma attacks is really important as nurses to teach our parents and our children. What is the most common reason for pneumonia in infants? And infants is 0 or 1 month, 28 days to 12 months, 1 year. Infants. And it's a virus, and it's called respiratory syncytial virus. Now, the RSV, or respiratory syncytial virus, for you and me is a common cold. But for an infant, it's that low-grade fever and extra mucus in the nose. And they can't suck, swallow, and breathe. So it becomes a respiratory problem. And then the virus gets in the lungs. How do we treat it? Well, it's a virus. We're going to give fever relief and fluids and rest. Which congenital heart defect causes increased pulmonary blood flow? Now, there's a couple defects that we have. We have a hole in the upper chambers called an atrial septal defect. It's the septum in the middle. And then on the bottom, we have the ventricular septal defect. And blood goes from the right side to the lungs, to the left side, and to the body. But when there's holes between the two sides, it goes back to the right side, and the blood goes back into the lungs. And that's what we call increased pulmonary blood flow. So A is fetal circulation. It connects the lungs to the aorta, and there again, extra flow to the lungs. A child swallows frequently after a tonsillectomy and adenoidectomy. What might this indicate? So when a tonsillectomy is swallowing, it means that those areas where they cut the tissue away and cauterized it is leaking and it's bleeding. So that's your first telltale sign. Never put anything in the mouth, no tongue depressors, but if they open their mouth slightly, you would see their tongue just full of bright red blood. And what do we do for that? Well, they need to go back to their surgeon. Sometimes they got to go get recauterized. I mean, and it can bleed a lot. I've seen there was a little 7-year-old girl who 1 week post tonsils, she had gone to the doctor. He looked at her, was on the way home. She vomited blood and blood clots, brought her right into the ER. This girl went into shock. She bled so much out of just tonsils. So a TNA is, oh, just a TNA. It's an in and out procedure. But we really need to tell these parents about the bleeding. It could be dangerous. Signs and symptoms of respiratory distress. Now, does it matter if they're adults or children? Isn't respiratory distress respiratory distress? So it's not bradycardia, it's tachycardia initially. Actually, late signs of respiratory distress is bradycardia. That's when the body is about to give up and that patient is about to code. Now, respiratory distress, the body tries to get oxygen around. So your heart beats faster, you breathe faster, your lungs are trying and they're getting full of fluids. Also, because you're in distress, you don't have all that oxygen. So that brain, it gets a little confused, a little bit restless. So that's why all of them. In infants, you would see nasal flaring. Their little nostrils go in and out. And at the end of a breath, you hear what we call a oh, what is an acceptable oxygen saturation for a child? And the answer is above 90. Doesn't have to be 95. 90 is good enough. When it gets less than that, then they would put maybe a little oxygen on with a little cannula or something. But 90 is good. A parent of a 3-month-old with cystic fibrosis wants to know how the child got this disease. Neither the parent has cystic fibrosis. You know, cystic fibrosis, like many other conditions, if, like for sickle cell, you have both parents with the trait, you have that 1 in 4 chance that that child is going to get it. Same thing with cystic fibrosis. That's why now they're doing testing of both parent to see if you both have the trait, to tell you you have a 1 in 4 chance of a child with cystic fibrosis, and that you carry that gene. Which fluids are most appropriate for a 5-year-old child with asthma experiencing dyspnea and fluid loss? Well, obviously, this child is well enough to be able to drink orally. If they were in severe respiratory distress, you would not be giving them anything by mouth. Nothing cold, believe it or not. Cold fluids, cold rooms, all of these things exasperate that asthma and that wheezing. So room temperature water is ideal, not iced. How long after a smoke inhalation injury are patients at greatest risk for pulmonary edema? Now, smoke inhalation, drowning are both an hypoxic and oxic episode, and it goes right into the lungs and damages it. And you're not going to see immediately what happens with it. It's up to 3 days later that all of a sudden they're going into respiratory distress. These children will be admitted and will be admitted with an O2 saturation monitor reading. 3 days later, it's very scary. What findings are expected when measuring the blood pressure on all 4 extremities of a child with coarctation of the aorta? Well, coarctation is the aorta comes up and over the arch into the body, and there's a kink, a narrowing. Blood can't get down to the lower extremities, but it's really good up top. So what would you see? I've got high blood pressures on the top and low on the bottom, and it would be decreased or no pedal pulses on this child because it's kinked. Blood don't go down. What type of diet should a child with cystic fibrosis be eating? I mentioned that they're having a trouble with fat and fat digestion in cystic fibrosis. The stools are very foul smelling and bulky and greasy because the fat comes out. So if you can't tolerate fat, what's left? We want sodium because sodium oozes out of their pores. Okay. That's how we do the sweat test, which looks for sodium in the skin when you suspect cystic fibrosis. And of course, protein, good and it wound healing and it's good for inflammation. Also, we would actually give high in carbohydrates too. Give back the calories as much as we can. So blood flow between vessels in the heart is called what? So if you have blood on the left side and you've got it flowing really fast and it goes to the right side where blood just gets back after a heartbeat, it's going to go from the left side to the right, and it's called shunting. Your body, when it has stuff in it and it has extra fluid, it finds that area of least resistance and it will move to it. It's like how the ears get clogged. Think about a heart. Left side, there's a lot of pumping going on. The right side, blood just got there. So if you had holes between those septums, it's going to go back to the right side, and that's called shunting. What is an atrial septal defect? Remember, septal is that septum, that division in the heart. There's 4 chambers. So it's an opening between the atrium, the atrials. It's the right and left, there's a hole. That is an ASD or atrial septal defect. What's the one on the bottom? Ventricular septal defect. Why do children with tetralogy of Fallot favor a squatting position? Now, tetralogy of Fallot is that blue baby, those tet spells. And the pulmonary artery just spasms and it doesn't let blood get to the lungs. So these children turn blue quick. So they squat because it's just like doing knee chest. It changes the pressure and it makes the return of the blood back and changes the pressure in the heart and it makes that pulmonary artery open up so blood goes to the lungs. That is tetralogy of Fallot. That is the most tested of all of your cardiac conditions. Which comment by the parent of a 1-year-old infant would concern the nurse about a possible congenital heart defect? Well, a congenital heart defect means the heart's not beating properly. What might you see? This is a child congenital heart defect. The blood isn't going the way it should. The oxygenation probably is not the way it should. They don't have oxygen, so they fatigue easily during feeds. They usually fall asleep. Sleeping all the time? Not necessarily. It's usually, I'm trying to feed the baby and I can't keep them awake. And usually any infant will wake up and want to be fed. So it's that tiring out. What does the nurse explain that a ventricular septal defect will allow? So hole between the two left chambers. What does it allow? Bottom chamber, the ventricles. There's a hole between the right and the left. Remember, it goes from the left to the right because the right side has least resistance there. And again, any hole between the septums, either the upper chambers or the lower, is going to cause increased pulmonary blood flow. And it has nothing to do with being cyanotic. The blood is still going to the lungs, still going to the body. What is a non-invasive procedure to determine if a heart is structurally normal and to find a murmur? We know when the infants come or the child comes, we just put them on the cardiac monitor. But the first thing is always an echocardiogram. And we know if an echocardiogram shows any defect, be prepared. That infant, child is going to go for cardiac cath. Rheumatic fever causes which inflammation? Rheumatic fever is a condition that occurs due to a strep infection that wasn't completely taken care of. There are symptoms that you will see. You will see a rash. You will see difficult movements called chorea. Your body, you can't control movements. You'll see polyarthritis. And you're going to see an inflammation of the heart called carditis. And our biggest concern is that the strep goes into the heart valves. Now, everything can be turned around except if there's valve damage, it's already damaged. How do we treat it? How do we treat strep? We're going to give an antibiotic, but a longer term, maybe a month or 6 weeks of it. A child recovering from rheumatic fever needs to receive monthly injections for 5 years of what medicine? What is rheumatic fever due from? It's due to a strep infection that was not treated. penicillin. Monthly injections for 5 years is a prevention. It's that protection of that heart. What threatening illness is caused by H. influenza and causes swelling above the vocal cords? It's viral. It's what croup turns into, which is laryngotracheal bronchitis. Not treated, you have the virus there, it turns into epiglottitis. Epiglottitis is the epiglottis covers your larynx, right? When you swallow, so no food goes there. Well, during this, all of the swelling is in the back of the throat. That epiglottis has gotten big. It's covering the larynx. No air can go in. It's an emergency. These children, you might need to have a trach tray or an intubation tray at the bedside. They are not moving air at all. So the nurse should prepare for emergency intubation when caring for the child with what? What might need intubation? I just told you. And that's epiglottitis, and if you're in there taking care of it, you call out, get somebody, go get this and that, get the intubation cart, and get it in here because once it's covered, you go from breathing and oxygenation, you could go down to no saturations. And remember, lack of oxygen, you worry about anything with the brain, right? Especially when you're talking young kids. How do you treat primary hypertension in a child? So, number one, a little activity. Get off the video games, get up, let's go outside, take a walk, right? And then the DASH diet. It's not that you take everything away, you just moderate for the child, okay? And we know it's the salt, we know that fluid, etc. Those are things that'll be looked at. DASH diet, increase activity. What congenital heart disease is diagnosed with an aortogram? What did I tell you is in the aorta? The name of that thing that kinks, that prevents blood from going to the feet, and it increases blood to the upper extremities. The coarctation of the aorta. And the aortogram is they just put dye in the aorta, and they can look to see where is that kink, how much flow is going through, and then they'll decide on surgery. Early signs of congestive heart failure. Congestive heart failure. The lungs are full of fluid, the heart's not beating good, you're not getting oxygen, right? What are you going to see? Everything. Number one, your body's not getting rid of fluid, it's filling up in the lungs. You're going to see a weight gain on the scales. Of course, no oxygen because the lungs are covered in fluid. They're going to tire easily. There'll be tachypnea, tachycardia, and they'll have dyspnea. What is the difference between HDL and LDL? And that's cholesterol. What is the difference? And then I'll tell you how I remember. When we look at those letters, HDL is healthy cholesterol. LDL is lousy cholesterol. So the HDL reduces and LDL increases the risk, okay? Makes sense. Healthy and lousy. hyperlipidemia is. What is that? And basically, it's cholesterol. So it's fat-like substances, triglycerides, cholesterol. It's too much in the blood and in the body. And how do we treat that with children? Just like adults. Diet. We try diet before any addition of medication. And last question. A hypoplastic left heart syndrome involves the underdevelopment of what? This is probably the most severe of all the congenital heart defects. It's when the heart doesn't pump because that left ventricle. This is a child who's severely cyanotic and will always be cyanotic. And they have to do multiple stage surgeries to help this blood get to where it needs to and get oxygen. So that's a hypoplastic left heart, and the left ventricle is what's no good. Oh, we have an AA. Good job, AA. CL. And the number one is A. What's that? Baby cakes and a C. So anyway, I will be meeting at 11 o'clock tomorrow morning. I'm telling you, almost everybody has passed. You guys have done well. And anybody who wants to meet me regarding that exam, and would really like to go through that exam and go question by question by question, you just let me know. Okay?
Professor, can you just look at your chat box whenever you get a chance?
Yeah, I saw your chat box. I saw your message. Let me look for you just quick. Oh, please, Princey. Are you kidding me? Are you asking me for real?
Yes.
You really don't think you did well?
It's the anxiety. Just
It's so
but
good,
your
I
one
don't
and
want to
my
tell
one
you.
is different. Okay, so you could just respond to me in the chat box.
I'm telling you, you did amazing.
Okay,
Who's
that's
that
all I
little
need.
cutie?
Winter.
Why, that's beautiful. Beautiful.
Yeah.
Is that the pacifiers from the hospital?
Yes, that's the only one that she likes.